Hi, this is Jessica Caudle. Today I'll be presenting the effects of online support communities on long hauler COVID-19 patients and how online support communities have shaped patient experience. This is done for the Department of Sociology at Appalachian State University and requirement for advanced research methods. The background for this research is that long hauler COVID-19 is quickly becoming a contested illness in America. Many long hauler COVID-19 patients have experienced adverse social effects and as a result have reached out to online support communities. And the effects of online support communities have historically been studied by sociologists. This research seeks to answer two questions. The first is, how have long hauler COVID-19 sufferers understood and navigated their disease, and how have their reported illnesses received by friends, family, and the medical community? The second question is, how have online communities such as Reddit shaped the experiences and understanding of long hauler COVID-19 patients? Qualitative research was best suited for this research, and then data was collected from the R COVID-19 positive Reddit community and was extracted using an R package named Reddit Extractor. There are two main types of data that were analyzed for this research. The first is original post, and then the second is comments on original post. Both were broken into codes for analysis, which can be seen in Table 1. The results of this research were common symptoms that were reported between patients were shortness of breath, fatigue, cardiac arrhythmia, nerve pain, and unproductive cough and fever. Many patients reported experiencing gaslighting by medical professionals and were prescribed antidepressants or anti-anxiety medications and told their symptoms were simply psychological. And overall, online support groups such as Reddit had a positive effect on long hauler COVID-19 patient experience. Many patients reported a greater sense of support and encouragement through these groups. For our discussion, it is this research is consistent with previous research that has been done by sociologists, especially research done by Conrad and Barker in 2021 that described medical gaslighting with people who were suffering from contested illnesses. And to enhance this research, further research could be conducted via surveys to gather more specific information that could help determine how health disparities in America have been affected by long hauler COVID-19. Information such as race, ethnicity, or socioeconomic status could be helpful in determining these factors.